Let's Talk Nursing is brought to you by bjninform.com, a learning platform for bite-sized, evidence-based content that supports all aspects of nursing. I'm Samina Hashimi, editor of BJ and Inform, and in each episode I chat with experts about topics across person-centred care, nurse well-being and career development. Together, we'll explore their experiences and discuss practical tips and insights that you can apply to your nursing practice. Hello and welcome to the second person-centred care episode of Let's Talk Nursing, the BJ and Inform podcast. I'm joined today by Gillian Morris and Brian Webster. Gillian is a lecturer at the University of Dundee and is also a qualified advanced nurse practitioner and district nurse with a special interest in health promotion for non-communicable diseases. Brian is a registered nurse and trainee district nurse at NHS Tayside. Brian also has an interest in health promotion, and both Gillian and Brian are members of the British Society of Lifestyle Medicine. Thank you both so much for joining me.
That's all right.
Pleasure to be here.
In this week's episode, we're talking about health promotion and the lifestyle changes that nurses can recommend to improve patient outcomes. Brian and Gillian have written a great introductory article about this topic on BJ and Inform. They're also working on an article series about health promotion across 4 main types of non-communicable diseases. You can find these in-depth overviews linked in the description box. So, first of all, you discussed in your article that there's no universal consensus on what health promotion is. That probably makes it quite hard to define, but I was wondering whether you could give us an overview of what health promotion can mean, particularly in the context of nursing.
Well, I guess you're absolutely right. There is no one agreed definition. The definition or the definitions that you see in the literature, I guess, have evolved over the years, particularly since the Ottawa Charter on Health Promotion, 1986. And from here, there has been a focus on the concept of empowerment of individuals and of communities to really take ownership over their health. So the World Health Organization have said that health promotion really is a process of enabling people to increase control over and to improve their health. But it also acknowledges the wide range of social and environmental influences and control that people have over their ability to be healthy.
Yeah, it's interesting because we're kind of still at that part from the Ottawa Charter where, there isn't an exact definition, as Gillian says, and some research will talk about actions and activities, and other research will talk about values and principles, and maybe it's a bit of both, really. But I think what the WHO's definition back in 1986 said still stands. It's about enabling the person to take control and not being authoritarian about that. But quite a challenging thing to do, which I'm sure we'll get into.
Yeah, we'll definitely discuss all the details around that. And in terms of sort of delivering health promotion, what are some of the strategies that nurses can do when promoting health? So, Brian, you mentioned this briefly in your response, but what are the actions that people have spoken about?
I think it's about small actions, and people tend to, particularly maybe healthcare professionals, think that health promotion's an entity in itself, and it is. There's, we have people who work solely in that area of work, but we all have an obligation and a sort of recommendation from our regulator, the NMC, to be promoting health at every opportunity. So it tends to not matter what your role is. So if you're an advanced nurse practitioner, if you're a district nurse, if you're an intensive care nurse, which might be a bit more challenging, but, taking every opportunity to promote health. So I think it does scare people a little bit to think, well, that's not me. I don't need to do that. That's not my job. I'm a hospital nurse in a busy surgical ward. That's for somebody else to do. But it's absolutely not, because you can use these little tools and these little tricks, such as brief interventions or motivational interviewing are two of the ones that are quite highly cited. But we've got some good articles, you guys at BGNI, Samina, on MEC, which is making every contact count, which is a part of brief intervention, you know. So it might be that you're a surgical nurse in a busy hospital, but you know that your patients came in with I don't know, a smoking related cancer. So, you know, it's not about patching them up and shipping them off. You could be having that 10-minute chat about, you know, what is your smoking pattern? What is your smoking habits? What can we do to maybe change that and look at that? It can be very short, very, very simple conversations. You know, it's not about a 1 hour delivery of, you know, information, or just giving someone a leaflet as well, which can be quite complicated in knowing the difference between, you know, handing someone a leaflet versus giving them a brief intervention.
Definitely. And you mentioned the Making Every Contact Count article there. I'll link that in the description as well so that listeners can take a look at that if they want to. You briefly mentioned sort of tips and tricks that nurses can implement, and you mentioned like motivational interviewing. Could you explain maybe in more detail what those look like?
Yeah, definitely. So Gillian will probably know a bit better than me because she's been around and nursed longer than me and lectures on these things. But, you know, motivational interviewing is all about sort of that positive outlook on the person, and what you could maybe call a bit of, you know, collective leadership, as in highlighting what the person is good at and getting them to focus on that. It's about affirmations. So, you know, saying, you know, well, you were able to do X, so why don't we try Y? Open-ended questions as well. So we wouldn't say, do you want to stop smoking? Because that's not open-ended. It might be, sorry, I'm focusing on smoking here because it's the top of my mind. But, you know, it might be, well, how many cigarettes do you smoke a day? And could you maybe reduce that by 5, you know, or something like that. But Gillian, have you got anything more about motivational interviewing?
Well, I was just going to just sort of follow up on what you were saying, Brian, because you're absolutely right about there is a myth that health promotion should take place more in primary care, but actually it's these really small tips that can make the difference, and people essentially need to acquire the knowledge, skills and information to allow them to make healthy choices for themselves. For example, you know, about the foods that they eat, or the access to services that they are entitled to. That nurses need to be really clear and work in a person-centred way where there's equal power sharing in the relationship to let people have the confidence in their ability to make whatever changes would benefit them. So that means a move away from this kind of biomedical approach that we still see towards a much more holistic approach. Nurses are also, coming back to what our regulator tell us, to be advocates for patients, act as mediators between the patient and perhaps referral on to other services, smoking cessation, for example, various, you know, other support services that are around. But another example, Brian talked about motivational interviewing, and that is that's a certain style in itself, but it can be small things like, for example, explaining to somebody fully how their medication works and why they're taking it, and for them to then take it appropriately to for the benefit of their health. It can also be things like understanding the impact of poverty on people and appropriately signposting to enable benefits maximisation, for example, to the Citizens Advice Bureau. It's always a really great place to point people in the direction of. Thinking about myself working in advanced practice and being somebody that regularly handed out fit notes for people about understanding the benefits of work and perhaps helping the person negotiate some kind of workplace adjustments or phased return to work rather than just signing people off. It's about understanding that to engage in work is good for people. These are just really small sort of tips that can be actually implemented into everybody's practice.
And it sounds a bit like basic communication and listening skills form the baseline of providing effective health promotion.
Yeah, absolutely. And I think thinking sort of broadly, and when patients are being assessed, like when they're being admitted, for example, make sure that in addition to the sort of clinical history taking and assessment, about understanding the importance of taking a good social history, because it's at that point where you're asking about lifestyle behaviours, about occupational history, these kind of things, and they will open up opportunities to give healthy tips.
I think that's really important, Gillian, because I think we laughed a bit about this when we were doing the discussion about the podcast about, no one eats fast food with an aim to be obese, so it's about why do people do that? So it's about that reflective listening and appreciation of, as we've highlighted in our article series, these social determinants of health, because, people might not go to the park for exercise because there isn't a park or there isn't a green space, or they physically can't get there for whatever reason. So it's not that authoritarian, right, you need to go to the park and do some cardio, for example, which is great, but what if there isn't a park, or what if there's nowhere to go, or what if they're isolated or lonely or anxious? So that's the important thing, I think, for nurses, because not to sort of diminish any of the other healthcare professionals, but there was a funny article that said a surgeon allows a patient to speak 15 seconds before they interrupt. And, that's really not the way to be promoting health. Having a good reflective listen to people, as well as a good reflective person-centred conversation.
You're absolutely right, Brian. And I think that's why, nurses are expert at communication. I would certainly argue that's something that we should be really proud of in our profession, is our ability to communicate with people on all sorts of levels.
And we're kind of veering in the direction of my next question, but why do you think nurses are best placed to deliver health promotion?
Well, I think nurses are the people who work most closely with patients and their families. That's a real privilege, and that they are also, well, as I've said, expert at communicating on all levels, and they have a duty to advocate and act on behalf of patients. And nurses are expert on the range of locally available services, for example, in communities, where they can make suggestions for patients to access.
Well, I would absolutely agree, and I always go back to the just amount of registrants there are in the UK, but of course worldwide, there's, I don't know what the latest NMC numbers are, but maybe 700,000 registrants. So, that's a massive opportunity to be promoting health and, advising people and guiding people on how they can make positive, healthful changes to their life. And I mean, there's no getting away from a medic, as in a doctor, is following probably a medical model. So I think, like Gillian says, that's where nurses come in to have that probably much more, dare I say, holistic, person-centred approach.
And like you said, Brian, I mean, if nothing else, there's just power in numbers, isn't there? So if every nurse was, promoting health, then that would probably have a really profound impact across the whole country.
Definitely, yeah. And it's interesting when you think about some of the more medical, I suppose, health promoting things, because some of the advanced nurse practitioners, and Gillian will maybe be able to confirm this, are prescribers. So they're independent prescribers, but a lot of their prescribing is deprescribing. So maybe somebody's on 12, 13 medicines that hasn't been reviewed for several months or years. And nurse practitioners are quite good at deprescribing things that don't need to be done. So you could argue that's promoting the person's health, because they won't have side effects, they won't have medicines that they don't need. But that's just an example of a more clinical health promotion thing. In our diabetes article, for example, we talk about some drugs that can cause type 2 diabetes. So yeah, definitely.
And correct me if I'm wrong, but it sounds like, based on what you say, a heavy focus on a biomedical approach almost takes away from that holistic aspect of care and that person-centered element, and almost works against health promotion. Would you say that's correct?
Yeah,
I think that's
definitely.
a really good point, Samina. I think this whole notion of empowerment, it's almost like, well, it's like an anti-authoritarian sort of approach. And we still are seeing that very much in terms of healthcare, and we really need to move away from that. And that's, in its defence, people are very busy, and that they want to get to the bottom of a problem. But that's a very short-term, quick fix. Now, for example, 60% of people who present at accident and emergency have a non-communicable disease, so a preventable disease. And perhaps if just a little bit more of a broader approach to their care and management, we'll see a reduction in these preventable sort of conditions. So it's a very worthwhile investment to spend time to in the longer term to help people to make healthy behaviour changes.
I guess a good example of this is antimicrobial resistance and antibiotic stewardship. We used to test all these folks' urine in care homes, and it would all come back as having all these positive elements, and then everybody would get blasted with antibiotics. But now we know that that's not best practice, and unless the person's symptomatic and we do a proper urine test and we don't prescribe antibiotics. But that was a very biomedical way of, okay, well, the urine analysis suggests they've probably got some changes in their urine, so let's blast them with antibiotics. But the cost of that, plus the harmful effects that antibiotics have on people. So yeah, it's an example of where we've kind of moved away from a biomedical approach to one intervention that was happening.
And that's a really good example, Brian. And it just makes me think of things that nurses do every day, like, for example, measuring blood pressure. Somebody has a reading that shows that a patient has hypertension. We need to get away from the tendency to treat with medication, but also identify opportunities. For example, the benefits of weight loss, exercise, stress reduction, reducing risky behaviours like smoking and excessive alcohol, and the impact that can have directly on blood pressure, and just taking that small amount of time to offer support and information for the patient to be able to do that.
I can imagine that it's quite difficult to sort of apply what you know about health promotion in real life situations. And a lot of that must depend on how ready the patient is to not only accept that advice, but actually implement this into their lives. So how can nurses assess readiness to change among their patients?
So nurses, I guess, need to be aware of underpinning theory, okay? Because as a now all graduate profession, everything we do is underpinned by the best available evidence. And there is a lot written around the assessment of readiness to change in patients. So there are simple tools that can be available to use, such as a readiness to change ruler, which is really a visual analogue of where the person feels how ready they are to change. The tools that are available will allow nurses to be able to predict how ready a patient feels they are to be able to make a change. And then depending on that, then that will determine the lifestyle changes that could be suggested. So for example, when you're assessing a patient and you are weighing them as part of the admission process, for example, you could say to the patient, have you thought about the benefits of perhaps losing some weight? And if you were to be interested, I could help you with that. So there are other theoretical models, Francesca and De Clementi, for example, and Becker's health belief model. They all explain the psychology of patients thinking around being able to make a change. So yeah, I would say nurses, it's all certainly embedded into undergraduate programmes and any sort of relevant postgraduate education. The underpinning theory is really important to understand.
Definitely. And I would just add that most of these things are a cycle, aren't they, Gillian? A bit like, you might drop into one part and then, make your way around this model or this cycle as a person, but then you might fall off again. But that's absolutely fine. You coming and going on the model. People have things going on in their life. So it's not well, it is a fluid thing, but, it's not what's the word? Prescriptive thing. People will have different.
It's not a linear thing.
Yeah, that's the word. Yeah, linear. It's not linear. Yeah, it's not, from getting from one side to the other. They might chop and change and veer and things like that.
Absolutely. And, I think this is one of the reasons nurses are so good at relating to people, is that we're people as well. And we can totally sort of empathise with that sort of, you're full of good intention and then you fall off the wagon, so to speak, and then you sort of reconsider that you're going to start again and so on. So, tell patients that you understand the difficulties and the challenges, or that you can certainly sympathise with them.
And just out of curiosity, Gillian, you mentioned it briefly in your response just now, but you talked about having to measure a patient's weight and then potentially discussing weight loss. I'm sure that comes up quite frequently in clinical settings, and it must be quite a difficult conversation to broach. Do you have any advice around talking to patients about their weight specifically?
What I would say is it's a sensitive, emotive topic, and it needs to be treated as such, and done respectfully. But we know from the evidence, and as I said earlier, we as nurses have a duty to work in a very strongly evidence-based way. We know the link between obesity, for example, and type 2 diabetes and these non-communicable diseases that we spoke about. So I think nurses are good at building their own sort of repertoire of phrases that they might find effective. For me, it was saying, have you ever thought about the benefits to your health from maybe losing a little bit of weight? And we know, again, from evidence that the weight loss doesn't need to be very much for there to be a considerable health benefit. So that could lead on to some discussion around dietary changes, and also signposting to places, to empower, back to this notion of empowerment, about pointing people to various sources to get them to think about it a bit more, or help them to think about it a bit more.
Mm-hmm. Brian, do you have any phrases that you've developed over the years?
Not really, no, because I think Gillian would probably agree. You can kind of sort of read the room and know the patient, and be aware of what's acceptable to chat about, maybe, and what's not, from your rapport that you build or your previous relationship with the patient if you've knew them for a while. I think it's just a case by case individual thing, but a bit like not sort of trying to, mollycoddle the topic. And we talk about this in death, and to use words like death and dying, but to use words like weight and obesity, and so the person really knows what you are talking about, and the benefits of it, I think are important, And I think it's challenging as well because people, back pain is a good one. So obesity and back pain are quite linked. But there's new NICE guidelines recently that suggest avoiding painkillers and offering exercise, and that can be a bit of a shock for someone because they maybe come to the practice nurse or speak to an AMP, for example, thinking, oh, I'll get some painkillers for this back pain, and they might need it because it's that bad that they wouldn't be able to exercise without it. So that could be challenging, saying, well, actually, no, we're not going to give you any painkillers today. We think you should maybe try some, cardio or some strength, or just a little bit more physical activity. So it can be difficult, but it's about having that reflective conversation with the person, and time tends to be on a nurse's side versus perhaps, GPs or busy doctors. We've got the ability to have a bit more time to go over these things.
And certainly, we need to have these. These are quite courageous conversations, but the benefit to the person is considerable, and it's important that we do have them.
Yeah, just because it's challenging doesn't mean it shouldn't be talked about.
Absolutely.
And you both mentioned this, but obviously nurses, being humans, can be very helpful when having these conversations and having that level of relatability with patients. But I'm sure there's a flip side to that as well, in cases where maybe a nurse's health or a nurse's lifestyle behaviours aren't the best or don't necessarily align with the health promotion that they're delivering. So what role does a nurse's own health play when delivering health promotion, and how could this potentially enhance or discount the advice that they're giving?
Well, in Scotland, we have one of our health policies is called the 2030 vision, and within that there's a section that outlines a nurse's responsibility to look after their health, because in recognition of the fact that nursing is a physically demanding job, and that we are going to be required to work longer than ever before. But I would also say that organisations have a duty to provide facilities and services that support health and well-being, both in terms of physical and mental health for nurses. And there's lots of evidence that this is linked to sort of things like job satisfaction and performance and absenteeism and presenteeism. People coming to work when they're not feeling well because they feel duty bound to come, to productivity, and to ultimately, I guess, to organisational culture. And there is evidence that, well, we know that as a profession, we have a higher level of overweight and obesity amongst nurses, and it does impact on how people might feel confident in giving dietary advice when they themselves, are aware that they would also benefit from losing weight. But again, it comes back to what I was saying about not shying away from the topic and understanding the evidence, the impact of being overweight on the health of everybody. It's a difficult one. It needs to be treated with a lot of sensitivity, because there's multifactorial reasons why people make health decisions.
Definitely. And I was just going to say relatability. If the nurse in question wants to broach that, I would probably still be classed as obese, looking at the terribly used tool, the BMI, because it would class a rugby player as obese when they're not. But I'm not a rugby player and I am probably obese. But, I have lost a lot of weight. I've lost 10 stone, and a lot of that's to do with lifestyle changes. So if the nurse wants to, having that ability to relate to the patient or the person, I know we're trying to move away from the word patient, but, to say, well, actually, I did this and this is my result. So maybe you might want to think about that. But then I also appreciate that, it might be the whole, say one thing and do another. So I've written 2 journal articles on fasting for the British Journal of Cardiac Nursing, but I still can't fast longer than 12 hours, which me and Gillian laugh about. But I know that if I get to that 16-hour mark, it starts to have positive effects, but I just can't do it. So going back to that being human, and we all have, flaws, and we might fall off the wagon, as Gillian says. But yeah.
I was discussing with somebody recently about cooking, and I really like cooking, and I wasn't aware that within our local area there's cookery classes for people that can be referred to those to go along and make things like soup, quick and easy but very healthy and affordable meals. And again, that comes back to what I was saying earlier about nurses just making sure that they're aware of the sort of not just the services within the NHS, but the sort of wider third sector voluntary bodies that exist in the local areas that might be able to support people to make lifestyle changes.
And I think it all has a knock-on effect, doesn't it? It's like this big positive cycle, because we know that people who volunteer, for example, or people who are part of a community have sense of purpose. They have lower levels of depression and anxiety because they have a thing to look forward to once a week, if it's the cooking class or if it's the spin class or whatever it might be. So it all has this great positive impact, and people don't actually realise it. They might think they're just going to the cooking class and that's great because they get their soup at the end of it, but they don't realise the sort of unconscious things that are going on within their mental well-being as well.
Absolutely. Brian, you've been involved in a really magnificent thing with the community garden. That's a really good example.
Yeah, definitely. And I was thinking about I was thinking about that when you said about the soup as well, because we need to, again, as sort of people who are delivering health promotion, it's all fine for me and Gillian to say to someone, a great way to lose weight is maybe eating more fruit and vegetables rather than carbohydrates, for example. But fruit and vegetables might be more expensive than carbohydrates. So we need to be thinking about that. And the community garden example was great because we had fruit and vegetables, well, mainly vegetables because we are in Scotland. But, it wasn't enough to give people a bag of carrots and a bag of aubergines if they didn't have the skill to do anything with that. Or equally, they maybe didn't have, the scope and the electricity budget to cook that, So then it was about maybe then linking up with, and it was about linking up with the local community centre to that cooking club. So, they took their vegetable to the next step in the sort of chain of the community. And of course, there was people who did just take the vegetables, but sometimes it isn't even enough to give people the thing. They maybe need a bit more than the thing, whatever the thing is.
Oh, I think that's a really beautiful example of, not only health promotion, but also collaboration across different institutions to help people cook tasty, delicious, but also healthy meals, really implementing health promotion in a very practical, very helpful kind of way. And what you both touched on feeds into my next question, but of course the way that advice is delivered is a crucial aspect of health promotion, but so is the information that's being delivered as part of that. What information around lifestyle choices do nurses need to be aware of in order to effectively promote healthy behaviours? And do you know of any resources that you would recommend nurses to take a look at when giving this advice? I know, Gillian, you mentioned sort of local community resources and things like that. Do you have any other similar or different examples?
Well, for me, at the highest level, there's evidence-based clinical guidelines. So NICE, the National Institute of Health and Care Excellence, have, in all of the conditions, have advice about lifestyle modifications for that condition. And they talk very specifically about eating a diet which is based around, essentially a Mediterranean type diet and the benefits of weight loss, reducing alcohol intake, all that kind of stuff. So there are those. Nurses also need to be aware of, current recommendations. For example, things like everybody should be doing 150 minutes of exercise per week. That's what the World Health Organization advise. And another example would be, we shouldn't be exceeding 14 units of alcohol per week, making sure that we're not drinking on successive days, that kind of thing. I, as a clinician, like to use apps for information. And if we think about sources of information, not only for nurses, but for patients, I particularly like, there's one called NHS MSK, it's called MSK, and it's for self-care for people that come with, back pain, knee pain, shoulder pain. It's developed by physiotherapists, and it allows people to undertake exercises to improve whatever it is that they have. And other things like, Couch to 5K app, for example, is brilliant to get people out and moving, and more, obviously not appropriate for everybody, but for people that were able to think about taking up something, quite aerobic, then that's a really good supportive app to recommend.
Yeah. And I think apps are really accessible and really easy for people to just start using. And it's also, I guess, sort of gamification of health promotion creates that added element of motivation, which is quite nice.
Absolutely, yeah.
Do you have any?
I was going to say our articles, but
yes,
I'm nothing like blowing our own trumpet. And then there probably will be some critics of our series of 4 articles that say this is all the same stuff, Gillian and Brian. You're talking about these 3 changes, but these 3 changes are the 3 main changes that all these non-communicable diseases are drivers of how to reverse or at least reduce the symptoms and the trajectory of them. And sorry, I was typing there because I was trying to pull up the British Society of Lifestyle Medicine, because, Gillian, I don't know if you could remember their 6 pillars of lifestyle medicine off the top of your head, but, it isn't massive things. It's, it's sleep, it's nutrition, it's physical activity and exercise.
Stress reduction, avoiding harmful substances.
Yeah. I don't think people, including nurses, realise, the sheer benefits of some of these what seem like everyday simple things, like getting a good night's sleep and not being chronically stressed. But they have massive impact on all these conditions that kind of blow your mind. And every time I read something about it, it blows my mind that having a good night's sleep can reverse hypertension, for example, or have a positive impact. I listened to a podcast yesterday on coffee having a good impact on inflammation and reducing inflammation. It's just amazing, and so it's about showing people that it's not about joining the gym and eating vegetables all day, every day, and not having any fun in your life. It's not about that at all.
You're right, Brian. And I in our latest article started getting very excited reading about green exercise and this concept of the power of exercising outdoors. And it doesn't need to be, it can just be going for a brisk walk. It doesn't have to be anything that requires expensive trainers or anything like that. So it's just about absorbing the feeling of the wind or the rain and listening to the birds and, looking up at the sky. That the benefits of that are, when compared to indoor exercise, it's really quite considerable. It's, really quite powerful. But it's just being mindful and aware of the impact that can have.
Yeah, and thank you for mentioning coffee there, Brian. I feel very validated in my caffeine addiction.
I think the guide or the recommendation is 3 to 4 cups a day, or mugs actually. 3 to 4 mugs gives you the
Oh,
perfect amount of polyphenols and all these amazing things.
I mean, that's quite generous. Have you heard anything about tea? Because I feel like I drink that more than coffee, actually. No.
I've not actually, no, but I'm sure
Oh,
there's polyphenols and everything. But yeah,
Yeah,
well,
there's antioxidants in tea. The tea is good, but the coffee, it should be black coffee, shouldn't it, Brian? Yeah.
hmm
And there's a link between black coffee consumption and its ability to break down non-alcoholic fatty liver, interestingly.
oh, that's
yeah.
amazing. Yeah,
Right?
I'm not quite hardcore enough to drink straight black coffee yet, but I might have to work towards
Oh, I
that.
am. I'm dependent on it.
But that, there's a small lifestyle intervention that might be, a brief intervention to talk about coffee, maybe just take the milk out of your coffee. And, dark chocolate has positive effects on cardiovascular health. So if somebody likes chocolate, is it that they switch to a much more cocoa-based chocolate, for example? We could be here for hours, but red wine again is another one. It has positive effects on cardiovascular health in a certain quantity. So, it isn't about, stripping away the chocolate and the wine and the coffee. So, but I
Well,
think that's,
absolutely. And
yeah.
you're right, Brian, the Mediterranean diet recommends, well, versions of it recommend some red wine, which I'm very thankful for.
We're thankful for all of these dietary recommendations. Yeah, I'm very excited about the caffeine and I do like a bit of dark chocolate, so I'm on the path to a very healthy lifestyle.
Absolutely.
And you both spoke a bit about your personal experiences with promoting healthy behaviors, but I was wondering whether there was any patient or event that played a significant role in your understanding of health promotion, and what lessons did you learn from this?
When I was a district nurse, there was an initiative in my local area to help people with pre-existing long-term conditions to help them make dietary changes. And it was run by the dietetic department, and I had to do some modules, and then I was to run this little class of I think there was about maybe 8 people in it, and it taught me a really hard lesson. And I know I mentioned at the beginning that the sort of notion or the concept of health promotion has changed over the years, and we've moved towards a much more empowering model than previously. It was more authoritarian, and I was talking about salt content to the group and about the dangers of salt, and to check, in processed foods, for example, and that we should avoid things like processed meats because they have a high salt content. And they went away that day, and then they came back the following week. And one of the people said, Gillian, you were talking about salt being dangerous. And I said, yes. And he said, what about pepper? And it really struck me that I had made sort of preconceived, I had ideas about people's level of knowledge, that actually people understand what is healthy on all different levels, and that we shouldn't make assumptions about people's existing knowledge. And I would hate, it's really important, it's really damaging to any kind of patient relationship if you come across as being patronizing, or it doesn't allow that equal power in a relationship. And so it really taught me a hard lesson to be much more mindful of what people understand health to be.
No, I think that's a great example of really listening to people and understanding their
Yeah.
perspective. And also, it's just really nice when people show curiosity and ask those questions. And the worst thing you could do in that situation is shut them down and make them feel like, they don't deserve to have any engagement with it, when, engagement is the main positive step there, isn't it?
Yeah, no, absolutely. And it was a great thing to do. And actually, the most important thing I think that came out from that group is that they struck up a friendship circle. And it comes back to what Brian was saying about social contact and the power and the benefits of that. That they had a sense of purpose coming along to the group, and they had a shared understanding of what the difficulties were in making health behaviour changes. And so friendships were struck from that, which was really nice.
Oh, that sounds really nice. Yeah. And Brian, obviously you talked about the vegetable garden. Is there any other example that you'd like to discuss?
Yeah, probably from district nursing, but nursing in general can unfortunately be very task focused. So when I started as a trainee district nurse, and previous to that as a community staff nurse, there is a lot of task focused work, and it is unfortunate because caseloads are so big. We know that from the Queen's Nursing Institute that caseloads are getting bigger and bigger. So you maybe don't feel that you have the time to promote health and think, well, why isn't this wound healing? You're sometimes having blinkers on and just treating the wound, but we're not actually treating the wound and thinking about the other factors. But diabetes is probably one of them. So we'll say patient A and patient B. So patient A, we were given insulin, a very ridiculously small amount, and this hadn't been reviewed for years. But nobody had thought, well, why don't we do a bigger blood test, an HbA1c, we call it, because we were task focused and we didn't think we had the time at 8 o'clock in the morning to think about maybe this person's in remission and maybe they can come off of this insulin. So yeah, that's my thing, is trying to be a bit less task focused. But that was a good example. Patient A came off of insulin, which was amazing. And then patient B is a patient who was, housebound, very isolated. We were going in and doing a lot for this patient, diabetes care and insulin delivery and wound care and all these types of things. And now that patient comes to the health centre and self-manages their insulin. So yeah, really good.
Oh, amazing.
Because we stopped looking at the task and try to think, well, if you walk up to the health centre, that's your maybe your 30 minutes of exercise that day, as well as that green space, as Gillian said, and the exposure to the outdoors, and maybe going to the shop on the way back, and there's a bit of a sense of community. So yeah, it's not big things. People don't have to change their life.
Definitely, yeah. And it's so good to hear a success story around that and to see, how moving away from a more task-oriented system of working can actually not only streamline general processes, but also create good patient outcomes as well. So I think now we can move on to our 3 key actions. This is where I ask our guests to outline 3 important practical actions that nurses who are listening can implement into their practice. So what is the first key action that nurses can take when promoting health? Gillian, I'm going to let you take this one.
Okay, so I would say that every nurse has the capacity and the ability to make tiny changes with their patients. Now, that might be through brief interventions, that might be through saying to patients, did you know we had a smoking cessation nurse that came here to the practice on a Friday? It could be signposting patients to the pharmacy that offers the sort of nicotine replacement, these kind of things. Every nurse has the ability to do that.
Amazing. And what is your second key action, Brian? It's your turn.
So mine's is probably having an awareness of the impact of these actions and these interactions. So going back to the personal examples we gave is really good evidence of these actions and interactions that they have, because then it gives you a sense of purpose as a nurse, and a sense of achievement and a sense that you've made a change. So yeah, really appreciating what you're doing.
And lastly, what is the third key action you'd recommend? I'll give this one back to you, Gillian.
Okay, so be armed with the facts and have an understanding of the underpinning theory around healthy lifestyle behaviours, so that you can support your patients as best you can, and also to implement them into your own lifestyle. We all should be able to follow the advice we give to our patients.
Mm-hmm. Which is drink black coffee and eat dark chocolate.
That's it.
That's all there is to it. No,
and read about articles.
Exactly. Right. So yeah, thank you so much for sharing those actions. I'm sure there are so many situations that require advice around lifestyle interventions where nurses can really implement these tips that you've just given. Now, to wrap up the episode, we're going to take a look at a reflective exercise together. So I'm going to read out a case study. This is the same case study that Brian and Gillian included in their article, Health Promotion for Person-Centered Care on BJ and Inform, which you can access using the link in the description box to do the exercise along with us. We'll then take a look at the reflective questions and discuss what Brian and Gillian would look for in a response. So first of all, I'll start with reading out the case study. Derek is a 53-year-old man who's had a recent diagnosis of type 2 diabetes, for which he requires metformin hydrochloride. This is the only medication he'll be taking, except for some analgesia he sometimes takes for back pain. He's not keen on taking the medication and would like to avoid medicines if possible. He works as an electrician and is independent in most aspects of his life. He lives alone and enjoys spending time with his friends, going out for meals and alcohol. Consider how, using a person-centered approach, you can work with Derek to promote his health relating to his lifestyle. So before I read out the reflective questions, what are the main things that initially come to mind when you're presented with this scenario?
So I think he's got probably quite an active job, so that's great. So he's obviously out and about quite a bit, on his feet quite a bit. So he's probably meeting quite a lot of his physical activity recommendations, but he might want to add a little bit more in. So like for example, I don't count walking the dog as exercise because I would do it every day. It's about what you could do above and beyond that, perhaps for someone who's looking to reverse his type 2 diabetes. Gillian?
I'd completely agree with what Brian's saying, but also I would add in that I would take a real empowerment approach, and I also, bear in mind the person-centred nature of the assessment, ask what matters most to Derek at this point in time, because quite often you will find that patients, their priorities might be a little bit different from yours, and just to make sure that what you are recommending is realistic, find out what is it that most matters to Derek. Is it, for example, treating his back pain? Is it keeping him in work? Is it, understanding the medication that he's taking? So that's what I would say there.
Mm-hmm. So let's take a look at the reflective questions now. So the first question is, given his new diagnosis, are there any approaches to health promotion that might be suited to Derek? Gillian, you mentioned an approach there, so could you expand on that and discuss what you would want to look for in a response to that question?
Absolutely. I would want to get a measure of Derek's existing understanding. What does he already know, and what does he need to know to keep himself healthy and well? I would think about brief intervention in terms of trying to support a behaviour change, perhaps in a change to his diet, and whether that's giving him information, whether that's referral on to somebody else. I would make an assessment and go from there.
Definitely. And the second reflective question is, considering that Derek also has back pain, are there any lifestyle changes you could educate and empower Derek about which would be beneficial for his diabetes as well as back pain? So you touched on this a little bit, Brian, but what do you think around this question?
So yeah, it probably is going to be his physical activity and exercise. So he's already doing, and these are terms that we touch on in our articles because there is a bit of a difference, So the fact that he is an electrician and he's got quite a laborious job, so he is probably doing quite a bit of cardiovascular things that he doesn't even realise he's doing, but his body will, when I go back to the dog walking thing, probably be used to that. So you won't really be getting his heart rate up to, a level that's positive for him. So just encouraging him to maybe do a little bit more and digging into, is it that he could maybe park further away from a person's house and have a bit of a walk to the person's house, or, little things like that. Is there a men's shed that he could join that have, a walking group or something like that? It probably is going to be physical activity and exercise that would tackle both, but certainly a nutritional approach to the type 2 diabetes if we were only looking at that. So unfortunately, he might have to take the metformin because his blood levels might be at that level where it's unfortunately unsafe not to, and we don't want him to end up getting other conditions from that high levels. But reminding him that this isn't a lifelong prescription. This can be changed from some nutritional changes, and that's not soups and shakes, which is a bit of a joke between me and Gillian. But it could be calorie restriction, it could be fasting, it could be a Mediterranean approach. But yeah, talking again, what's realistic for Derek? It might not be fasting, it might not be calorie restriction. So therefore, it might be adding more fruit and vegetables. But again, we'll have to think about his health literacy. So we aren't going to talk about polyphenols and legumes and things like that. We're going to probably have an awareness of his health literacy and go from there.
Or pick up a few free fruits and vegetables from your garden.
Absolutely.
No, amazing. Thank you so much. Those are all really great points and definitely give a lot of food for thought, especially for our listeners who are doing the case study along with us.
Great pun there, food for thought.
Didn't even do it on purpose. So that essentially brings our episode to an end. Brian and Gillian, thank you so much for joining me on Let's Talk Nursing. It's been such a pleasure talking to you about such a key component of providing person-centered care. Before we go, I wanted to point out that Brian has his own podcast, Leadership 321, about all things leadership in healthcare. So if this is something you're interested in, you can find a link to the podcast in the description box. Thank you both so much.
It's a pleasure.
Thank you.
If you enjoyed this episode of Let's Talk Nursing, do follow us for new episodes and share with your colleagues. For more resources and past episodes, visit bjninform.com. Thank you so much for listening and see you next time.